part of that is cost, I think. And then, does the report focus solely on repurposed drugs, supplements, and lifestyle factors, or does it also address other alternative treatments? And you put a few examples there in the chat, Peyton: vitamin C, hyperthermia, mistletoe, HBOT, etc. And this is a fairly simple one. It addresses, the Astron report includes any intervention, anything that you've included where there is peer-reviewed data. So we are only limited by the availability of the actual peer-reviewed literature, and clearly that is incomplete. And so the beautiful thing about what we're doing at Astron is that we can continuously update our engine in real time to reflect the thousands of papers that are relevant and that are coming out every month on topics that are related here. And so we can keep up in a way that no oncology group can. And that's vital because the scientific data is vast but incomplete. And the amazing thing about this is that the clinical data is even more incomplete. So what's going to really inform our approach is that we're going to get the outcome data from the patients and be able to use that to help us understand what interventions are working and to discern why that might be. And I think both, Peyton, you've mentioned, are there any case studies or patient success stories you can share? And Lynn has also asked that. Do you have any data for patients you've helped by supplementing their treatment with your reports? I know you mentioned someone earlier, Dr. Meakin, but any other particular case studies that you can think of? Or
I'll jump in here. Yeah. So, with the use of repurposed drugs, lifestyle changes, supplements, and so forth, we have a lot of individuals that seem to have cracked the code with their cancer, and even their local doctors are starting to say, whatever you're doing, you're an outlier, keep it up. I think as far as the new precision delivery with Astron, we're early into that. And, I'm always excited in a follow-up where people with a high-risk condition and remain NED from different measures, are starting to kind of show patterns where, most people would have recurred by now, if, in this disease. So we don't have any direct evidence with Astron, to my knowledge, in the population I see, but a lot of individual cases are starting to show. And I'll also add with Astron, it's great because they look at peer-reviewed data from outside the U.S. And so, a lot of times we all work in these silos, and then, things have already been tested elsewhere. And they, were never really on the radar screen of our, local U.S. oncology populations.